So good morning. So I'm gonna perform incentives spirometry. So before going inside the patient's room, we always do check the patient's chart to make sure that the physician did order the therapy. Then once inside, we introduce ourselves to the patient, and then we always explain to them and then tell them that's the purpose of this, such as good morning, my name is Anthony from the respiratory care department. So the doctor ordered you incentive spirometry. So this therapy is indicated for you as you are going to surgery later on, and then this would help you expand your lungs even more. It would prevent your lungs from being collapsed, and also it would help you reduce any secretions present. So after that, we always wash our hands or sanitize and then wear gloves. And then every time we go and perform a therapy, we should check the patient's ID band for confirmatory purposes, and we should do a set or vital signs and then assess the patient first. And then every time we do our assessment, we always include auscultation, especially it is important when performing this incentive spirometry. So once everything is done, we position the patient upright. If they can sit, that would be better. Or if not, we can assist the patient or we can adjust the patient's bed. And then when setting the device, make sure we inspect for any cracks present, if especially in the bottom, especially it might fall down. So when there is, make sure we replace it with a new device. And then after this, we insert the mouthpiece. Make sure we properly insert it. And then every time we perform the therapy, we also have to take note of the patient's gender, and we should also set the appropriate volume based on the patient's height and age. So for example, I'll be using myself as the patient, so mine is about 2000. Oh yes, almost 2000. So I'm gonna set it in here with this yellow one, and then the patient should hold it upright. So you can also assist by holding it. And then first is you let the patient exhale all the air out until their lungs feel their lungs are empty. So every time you do this, after exhaling, put this one inside the patient's mouth with their lips sealed, and then let the patient take a slow deep inspiration. And then once you notice the white piston reaches the appropriate setting, let the patient have a breath hold for about 3 to 5 seconds, and then after that, allow the white piston to drop until if it drops already, remove the mouthpiece and let the patient exhale normally. So every time we do this therapy, we should always demonstrate in front of the patient so that they would understand really well. So assuming we're done demonstrating it, so we should start. So if we want to do this multiple attempts, ideally it should be about 10 times per hour. But if we started it initially for those patients, especially with the elder people, you can start it about 5 trials per hour and then gradually increase it if they can tolerate it. So every attempt, let the patient rest, and then if they can cough, let the patient cough, assist them, and then try to take note if they're able to expectorate with the color consistency and amount of its sputum. So once everything is done, we should not wash this one. It should be set up and clean dry only with a mouthpiece. They can wash it with sterile water and cover it with a clean tissue cloth. And then both of these, after being air dried, should be put up in this plastic container bag. And then let the patient also educate that they should also practice this every hour. And then also, it is not indicated to use this when the patient would go to sleep during night and also unconscious or uncoordinated. So once everything is done, reassess the patient, make sure we auscultate it, and make sure we take note of the outcomes such as reduce of any atelectasis, improve their breath sounds, and also position the patient back, make sure they're comfortable, remove the PPE, wash our hands, and then once outside, make sure we take note of the pressure or volume where the patient was able to tolerate, and then make sure we also include communication, constant communication with the staff.